morning and welcome to the March edition of Insight. I'm Lori Schermerhorn. I'm the President and CEO of the Vision Resource Center of Berks County, and I have the pleasure today of welcoming our two guests, Dr. Dawn Hornberger and Dr. Heidi Sensenig. So welcome to you both. Thanks for joining us. And so let's get started. So if you would please introduce yourselves and exactly what you do and your connection to the VRC.
Sure. I'm Dr. Heidi Sensenig, and I work at YMSing Optometric Center. There I practice various types of optometry, pediatric optometry, neurooptometry, and low vision. So my background is occupational therapy, and that part of it helped me to get into the rehabilitation side of vision care.
Wonderful.
And with the VRC, I'm on the board and help out with lots of different committees and events throughout the year, too.
Wonderful. Dr. Hornberger?
I'm Dawn Hornberger, and I'm an optometrist also and a low vision specialist. I've been in various different places in Berks County that I've worked. I currently have two practices of my own, one in Birdsboro and one in Warnersville. Berks Family Eye Care, and I also am the low vision consultant with Eye Consultants of Pennsylvania. I have been involved with the Vision Resource Center for many years. I was on the board for a number of years and now serve on various committees. And I do routine optometry as well as low vision work throughout the different practices that I'm affiliated with.
Wonderful. Okay, so can we start with explaining the differences, like with legally blind and blindness and the visually impaired? Because I think sometimes people get that confused. So,
sure. I think there are some very specific numbers that are associated with legal blindness. So that would be 2200 on the eye chart. Or a visual field of 20 degrees or less, so just being able to see a small amount of the entire visual field also qualifies as legally blind. And then, did you want to talk about?
Being visually impaired, the criteria that a lot of organizations use is 20/70 or worse, or field loss that impacts on someone's vision. But to be honest, I personally find that those numbers are really meaningless. Someone's ability to function can be very significantly impaired with rather good acuity because of blind spots and distortion in the vision and various other contrast sensitivity issues. And you can have somebody who has actually quite bad vision on an eye chart and they function quite well. So, the numbers are there for guidelines, but I feel like, anyone who's struggling because of their vision and it can't be corrected with normal means such as contacts or glasses, that would, to me, be somebody who's visually impaired or has low vision.
Okay, thanks. And what are some of the common indicators that a person may be losing their sight?
So it depends on the perspective. If you're talking about, common indicators of you observing somebody or that person themselves, but either way, maybe starting to struggle with daily activities. So whether something that was easy before, managing their checkbooks or things like that, they're starting to mix numbers up, or even before that, street signs and things like that can start to be difficult. And as an observer and a family member, sometimes it's important to take notice if somebody's giving up their hobbies and they're not reading as much, or they haven't picked up their knitting in a while or something like that, to start asking questions and see if they're struggling in some way.
Do you have anything else?
I would just say that, sometimes people will have no symptoms before they lose the vision, and that's why it is so critical that people do receive routine eye care, because there are so many conditions that affect the vision that by the time they have symptoms, it's too late to really do anything about it. So, I would not take I see fine as an indication that the eyes are healthy.
Absolutely. What are some of the most common eye conditions that you see in children? What ages and the symptoms, causes, treatment, like anything like that?
Sure. In my practice, I see quite a few children, and I do have a bit of a referral-based practice that way, where if somebody's struggling with issues with reading, eye teaming, focusing, double vision, things like that, they are referred to me for that reason. So that's why personally, that's one of the highest for me. So it might be strabismus, an actual eye turn, or amblyopia, where one eye, you might hear of it as called lazy eye, but where one eye doesn't see as well as the other eye. Or even before that, just the continuum of how their eyes work together as a team. They may be skipping around while they're reading or struggling in some way there. So, treatment, would start at certainly the best glasses and the best visual correction for them, and then from there, various types of treatment depending on their condition. So it could be anywhere from therapy and sometimes even surgery to address, an eye turn itself. But we would certainly work on individualizing that for the person.
Sure. And Dr. Hornberger, with adults, what are the most common things that you're seeing?
Cataracts are probably the most common thing that the typical person will present with as an adult that is an issue with their vision. I mean, certainly needing glasses is something we all need, whether we're nearsighted, farsighted all our life, have astigmatism, or we hit 40 and we need bifocals or reading lenses for the first time. Those are certainly the more common things, the refractive things that are very simple to take care of with glasses or contact lenses. But as far as medical issues with the eyes, cataracts are probably the most prevalent thing. Pretty much everybody starts to develop cataracts as they age, and they are very simple to take care of. Simple if you're a good surgeon, but certainly something that we have treatment for that's very effective and very safe. Glaucoma is also extremely common, often does not have any symptoms until you lose the vision, and that's too late at that point. So that's one of the main reasons we recommend routine eye care. People will have macular degeneration or diabetic eye disease or various vascular problems that can impact their eyes. If you have high blood pressure, heart disease, problems with hardening of the arteries, whatever it might be, something that's just not letting your circulation be what it should be. That can affect things, strokes, injuries, optic nerve problems, cornea problems. I mean, it runs the gamut. And each of those things has a whole set of different symptoms and treatments that are available.
Okay. What advice, what advice would you, as an eye doctor, give to the parents of a child who's maybe in the stages of losing their vision or has already lost their vision? Because again, it's sort of different if they're in the process of losing as if they've already lost.
Sure. So some of the conditions that I see that might correlate with that wouldn't necessarily be what I talked about before, but would more be Stargardt's, maculopathy, which is a type of, you might want to think about it as a type of macular degeneration that young children can get, or ocular albinism. So I have quite a few kids in that category, and those kids usually, so they progress a little bit and they get worse and then they stabilize. So certainly educating them well on the progression, the natural progression of their condition, even though everyone's different, they should know that they're not going to go blind from it, in other words. So just support and education, I would say, is the most important thing there. Because if they truly understand, at their own level, and then for the parents at their level, if they understand what's going on, it can just give them a lot of comfort to know exactly what they're dealing with. And then certainly support. I have a family that I work with that has, they do a great job of getting their kids to different conferences related to their eye condition. Wow. They travel and meet other people that have the same thing, even though it's really rare. So that's really cool, because then they see other kids that are just like them and have the same types of issues to deal with, and that they can do well with it.
Sure, and it becomes their own little support system too. So
yeah, and they talk to their friends and they hear like, oh well, so and so had this test done, and I wonder what mine is, and they start to be able to understand their condition at a different level. And so I think that's important.
Wonderful. Dr. Hornberger, what steps do you go through when you actually start examining someone who's losing their sight? And would your exam be different depending on the person's age?
It depends on, certainly, and every person that is evaluated needs to have a complete eye health evaluation to determine what the actual problem is. And the most important thing of any examination of any kind, whether it be a low vision evaluation or your medical evaluation or your visual evaluation, would be the history. Truly, when I see a low vision patient in particular, we spend probably 80% of our time doing a history, because knowing what that person's needs are, knowing what they're struggling with, knowing what the circumstances around their vision loss are very critical. Making sure that you know why the person's losing their vision, what the actual visual acuity is, what their limitations on visual field are, knowing what you're dealing with first, and then again, knowing what the person's needs are, tailoring your exam to those needs. The first thing we would do is, in trying to address that, would be making sure they're refracted. And I typically spend a huge amount of time refracting somebody. A lot of times when somebody is refracted and they have normal vision, it's going to take a couple minutes. It can take a half hour, 45 minutes, and we may try lenses. We may put lenses into a special frame, have them play around with it, see how they do with it. It's a much more intensive patient-centered evaluation. And then once we know we've given them the best possible glasses, then we have to look at, okay, can we get them very high reading glasses, high-powered reading glasses, or a magnifier of some sort, or some type of electronic equipment, a telescope, binoculars. There's all kinds of electronic aids that someone can use if they're visually impaired. And then I spend a huge amount of time when I'm working with a low vision patient in particular, connecting them with the various resources in the community, because sometimes having that support system, having the Vision Resource Center that they can use as a help to get them connected to other resources in the community, having a support group, having counseling services available to them, knowing that there is a state organization that can possibly provide funding for some of their devices, and providing assistance in their home. They might need just to have teaching on how to do things differently. There's a whole slew of transportation options. There are a lot of different things that we can connect people to that help them not feel so isolated.
Wonderful. Have there been any changes in the treatments for specific eye conditions? I mean, there's always research being done, so maybe we should sort of take this one issue by itself. Let's start with macular. What's going on in the world of macular and treatments and things like that? Macular degeneration, if you look at the different types, dry and wet, and what part of it you're looking at, certainly injections are one of the things that you'll hear a lot of people talking about if they have wet macular degeneration. And they're always looking at, what frequency of injection do they have to, some people have to go every 6 weeks and have that done. And sometimes they can stretch that out. There are different medications that can be used, and it's not always the same one that's effective for one person as effective for somebody else. So that's been the mainstay, but continues to really be, the standard as far as treating wet macular degeneration. I know with dry macular degeneration, they're really doing a lot of research to try to find something new and different, because right now it's really nutrition and supplements that are helping to hold things steady, but don't necessarily reverse any of the vision changes. So they're always looking there. Is there going to be something down the road that can be utilized? But it's been injections for a while. Anything else that you can think of? At the
moment, there's nothing that I'm aware of that's new.
And what about with glaucoma or with cataracts? We sort of talked a little bit about the cataracts, so we're looking for surgery a lot of times. But what about with glaucoma?
Glaucoma is something that there are a lot of treatments available. There are a number of different medications. They're in the form of an eye drop, and there's always new ones that are coming out for that. They're looking at different delivery systems for that, whether it be instilling the drop onto, say, a contact lens, so it's a slow release, that it's not something that you're putting in and then you're done, that it's something that's gradually releasing into the body. They're looking at doing depots, which means that you inject a medication under, say, the skin of the eye, and then that medicine again slowly releases. They're looking at various other things that are not available really right now, as far as how are we getting that pressure lower with medication or with other techniques. They have recently started doing a procedure where they put little stents at the time. Unfortunately, in our country, it's only approved at the time of cataract surgery that this can be done, but there's these little stents that they can put in the trabecular meshwork, which is where the drainage happens inside the eye, and they've been quite effective. There are various surgical techniques that are being used, various laser techniques to try to increase the ability of the eye to process the fluid so that the fluid pressure goes down. There are a lot of new things going on with glaucoma right now.
Wow, interesting. Thank you. What about vision therapy, and do you recommend it, and have you noticed or do you feel that it's more effective with kids or with adults? You know, what's your take on that?
Sure. I would say that depends quite a bit on what condition, that we're treating. So at my office we do have in-office vision therapy, and primarily right now I'm working with a lot of children with binocular vision issues that we talked about, eye teaming and focusing, but also concussion patients that have actually similar diagnoses. So 50% of concussion patients have convergence insufficiency, in other words. So it throws things off about the way their eyes work together. So sometimes those are the things we're working on, but also we can be looking at things like combining vision loss that we've been talking about, visual impairment with therapy. So there are types of therapy where, let's say with macular degeneration, you have a blind spot, in the middle of your vision, and you're trying to learn how to use your side vision a little bit more effectively. We're used to using our central vision for everything, but so those programs can really be customized depending on what we're exactly talking about. Of course, I recommend it because I do it. No, but really I do, but also not just as a blanket statement. I would say that if you're thinking that you've heard of it and would it be helpful to you, to search out somebody that that does do it, and just to learn a little bit about what could it possibly do for you, and to go from there with it, and just it's certainly not the same at every place that you would go, or people do not refer to vision therapy as the same and mean the same thing all the time.
Sure.
But I would say that it works well with adults and children, as long as you select, the right person, the right patient, that would be benefit.
We've talked a little bit about people who are visually impaired, and people are very familiar with a cane. With using a cane to maneuver around things. How important is it for someone who's visually impaired to actually use their cane?
I think that depends on the person. There are often people who are very resistant to using the cane for a variety of reasons. They don't want to be targeted because people now know that they have an issue, or just because of self-consciousness, that they don't want people to be identifying them as someone who has an issue. But there are certainly safety factors that have to be considered. And if someone is putting themselves at risk of injury because of falls or bumping into things, or even in traffic, if they have a cane, it easily does identify them to others, so that they're not wondering, why is this person stepping off the curb in front of my car? At least they're a little bit more likely to respond to that, not just think, oh, this person is a jerk and they're not paying attention to my vehicle. I think there is something to be said for that as being an identifier that helps people to respond in an appropriate way. But it is an individual thing, and also depends on the environment they're in. If someone is in their home environment and they're very comfortable and everything is always in the same place, you kind of know where things are, you can navigate that without the assistance of a cane. But if you're in an unfamiliar environment and you don't have a sighted guide with you, I do think it is very important for some people. The people who have loss of peripheral vision certainly are the ones who benefit the most by cane use, because they don't have that side vision to give them clues as to what they're doing as far as walking and bumping into things and where objects are in their environment.
Oh, absolutely. Do you have anything to add for that?
No, I think that's perfect.
For someone who's just losing their sight, what advice would you give them about overcoming the new obstacle? I mean, we usually see it after they've been to their eye doctor, and maybe the eye doctor has referred them to the Vision Resource Center, and a lot of times what we're seeing are people who are very angry, resistant, I've done it this way for so many years, why do I have to change now? But again, with things changing in their vision, you sort of have to get them there. So what advice do you give them when they see you in the office?
Sure, I think that comes up quite a bit because sometimes there's a communication thing where when someone refers a patient to us as a low vision specialist, they say, go to this doctor, they're going to take care of your problem. And what that means to the person is they're going to make everything perfect like it was before, and that's not what we're going to do. So I think educating them a little bit on exactly what their condition is doing to their visual function and the fact that we can't go backwards in time, but we can work around it. However, we need to use new tools to do that. So we can't do things the old way and still get the same visual function because we're working with different eyes and we're working with eyes that are now damaged in a certain way. So if we use tools that are very specific to their needs, then that they do have to have a little bit of an open mind at that and just try things and realize and accept that things might be a little harder, especially at first until you give it a chance, but also giving them the opportunity to be upset and giving them the opportunity to grieve their old vision and how it was, because that's fair too. So with that, I would certainly say what we talked about before and connecting them, to social networks and things like that can give them that support.
Anything to add?
Well, I do, just to add to that, with the Vision Resource Center, it is a wonderful resource that we do have in our community that people can meet up with other people who have these same issues. There are support groups for both family members as well as the person who's experiencing the vision loss. And it can be so helpful to know that you're not the only one, that there are other people. And I think hearing from someone else who's been through this as to how they've changed how they do things is far more effective than we as doctors saying, okay, you should try to do it this way, because they don't believe that we could understand that, and we can't because we've not experienced it on the same level. So I do think that support groups and being able to accept what has happened and again grieve it and be able to realize I'm going to have to do things a little differently from here out. Doesn't mean I can't do them. I just may need to find a different way to skin the cat.
Right. Oh, absolutely. And I mean, that's something that we see. I do have, some staff at the Vision Resource Center who are blind or visually impaired. And again, it's not that they can't do, but we do need to change things. And there are times where they tell me that's not going to work. And I'm like, oh, but it will. And we do always seem to find a way. So last question for both of you. What advice would you give for caregivers who suspect that their loved one is losing their vision or they've already been diagnosed? Because a lot of times, it may be the husband or the wife, and then the other one, has that role for the caregiver. What do you say to them? How do you handle that?
One thing I think sometimes is confusing for family members is that they think either somebody sees everything or nothing, and they don't understand that there may be certain tasks that are very difficult for the person and other tasks that are not. So having them understand the condition and how that impacts the person is important. Also, they need to understand that this is a grieving process, that it isn't something that, it is just like having any other loss. You have to work through that. And the person may be angry, and they may take it out on you. And that's, again, where having other people who can help you through that is a good thing. And then also being an advocate for your family member, because I find so often someone will come in an exam room and their family member doesn't come in with them. And I think having that other person who can remind them of what we've talked about in the exam room, and someone who can help to support them in doing things in a different way. Something as simple as you need to hold things a little closer when you read and make sure your lighting is good. When they get home, they may forget that that's what we said. And if you have somebody else who's there who can say, do you remember she said, hold it a little closer? And that goes a long way for having somebody be able to help to advocate for their family member.
Absolutely.
Exactly. And then they can see too how they are actually functioning throughout the exam, and they can say, oh, they could see that on the chart, but they couldn't see it at this distance, and they could see. So they'll just having experienced that, because a lot of times I'll hear, especially husbands and wives that like to argue about things, they'll say, well, you could see that. Like, how come you can't you can't help with something but you saw that dime over there on the floor, or something like that. I hear things like that quite a bit. But if they're sitting in there with you and they're working through each step of the exam with you, then they're more of a team going into it and can kind of see both sides of it. And then also just at Dine in the Dark, which is one of the very cool events that Vision Resource Center does. We were able to all try on simulators that allow you to, and it's not exact, but to kind of see what it would be like to have partial vision that's inconsistent. And so I think it's neat if you can try something like that that gives you that experience.
Wonderful. Well, thank you both, as we're about out of time. Just remember, if you want any information on our upcoming events, you can call 610-375-8407 and extension 123. Thank you both, and have a great day.
Thank you.